Have you ever stopped to think about what protections are in place when you sit down for a psychological test? Well, today we're diving into the essential ethical principles that are there to safeguard you during an assessment. And these aren't just some dusty old rules for psychologists. They're actually your rights.
So, let's get right to it. How are you protected? The answer lies in a really robust ethical framework that every single qualified professional has to follow. Let's break down what that framework looks like and what it really means for you.
You see, these tests, they're so much more than just a series of questions. They are incredibly powerful tools. They can shape huge life decisions. We're talking everything from job opportunities and school placements to serious clinical diagnoses. And because of that, the ethical standards for how they're used are just absolutely critical. This quote right here really captures the gravity of it all. It highlights exactly why these ethical rules aren't optional. The stakes couldn't be higher, and the results can, quite literally, alter the course of a person's life.
Okay, so here's our roadmap for this explainer. We're going to walk through the 4 core pillars of ethical assessment. We'll start with the mandate for competence, then move to your right to informed consent. After that, we'll cover protecting your confidentiality, and finally, we'll talk about why maintaining test integrity is so important.
First up, let's talk about the absolute cornerstone of ethical practice: competence. Seriously, think of this as the foundation that everything else is built on. A psychologist's expertise isn't just a bonus, it's a fundamental requirement.
So, what do we actually mean by competence? Well, it's this ethical duty for professionals to not only have a high level of expertise, but also, and this is key, to know the limits of their own knowledge. It means they should only be using assessment tools that they are genuinely qualified to give, to score, and to interpret. And this isn't just a vague idea. We're talking about very specific requirements. It means substantial training in how tests are measured and designed, a deep knowledge of a test's blind spots and limitations, and an awareness of things like culture and language. It also demands supervised experience and, of course, a commitment to keep learning to stay on top of the latest in the field.
All right, so building on that foundation of a competent professional, our second pillar shifts the spotlight over to you, the person being assessed. This is all about your fundamental right to what's called informed consent. This whole principle is about your self-determination, your autonomy. You are not just a passive subject in this process. No way. You're an active participant, and you have every right to make a clear, informed choice about your own assessment. Now, for your consent to be truly valid, it needs to hit 3 key marks. First, it has to be completely voluntary. No pressure, no coercion. Second, the person giving consent has to be legally and mentally able to do so. And third, they have to be given enough clear information to actually understand what they're saying yes to. And the information you get has to be pretty detailed. Before anything begins, the psychologist should be telling you exactly why you're being tested, what the results will be used for, who's going to see them, and, this is a big one, that you have the right to refuse or to stop the process at any time.
Okay, on to our third pillar, confidentiality. This is the very bedrock of trust in any psychological relationship. It's that promise, that guarantee that your personal information is going to be kept private.
This quote here really says it all. The importance of confidentiality just can't be overstated. Without that trust, you can't have an honest, effective assessment. It just wouldn't work.
Now, while keeping your information private is the golden rule, it's not totally absolute. This chart kind of shows the balance. On one hand, all your personal info is protected. But on the other, there are some very specific, legally required exceptions, like a risk of someone getting hurt, suspected abuse, or a direct order from a court.
And that brings us to our fourth and final pillar: maintaining test integrity. This is all about protecting the assessment tools themselves, making sure they stay accurate, fair, and effective for everyone.
So why is test security such a big deal? Well, think about it. If the test questions or the answers got out, the test would become useless. It wouldn't be valid anymore because it couldn't measure what it's supposed to. So protecting that material is a core ethical duty.
But integrity goes even deeper than just keeping the questions secret. It's also about fairness. A psychologist has an ethical responsibility to make sure the test they're using is actually a good fit for you, the individual. That means considering things like your cultural background and making sure the results are interpreted with those differences in mind to avoid any kind of bias.
So, as we wrap up, it's pretty clear that these ethical principles aren't just a one-way street. They really represent a shared responsibility, a kind of pact between the professional and the client that's built on a foundation of respect and total transparency.
So, Let's do a quick recap of your safeguards. First, the professional must be competent. Second, you have the right to know what's going on and agree to it. That's informed consent. Third, your privacy is protected, with very clear legal limits. And fourth, the whole process has to be secure and fair. These pillars work together to protect you.
And that leaves us with one final thought. Is ethical assessment simply a professional duty, or is it a fundamental right? Well, the truth is, it's both. It's a duty professionals must uphold, and it's a right that you should always expect. Thanks so much for joining me.